From the News Channel 5 Network, this is MorningLine with Nick Beres.
A good show on tap for you. Invite you to join in the conversation. This is something that I am very interested in, not just for myself, but for some people, including my parents as they age. The question of memory loss, issues like Alzheimer's, of course, but other issues of remembering things that maybe aren't quite as serious there, as we all maybe sometimes forget a name or where we parked our car, and how you know whether or not you have an issue or not, and more importantly, beyond that, what kind of treatments are out there, what kind of things you can do to strengthen your memory, foods, vitamins, you hear about that all the time, and also for those who have been diagnosed with, cognitive issues, memory loss, Alzheimer's, what kind of treatments are being looked at there? And of course, we have a wonderful medical community here that deals with this, including Vanderbilt Cognitive Medicine Department there and studies that they've done. We're going to talk about one of them with regard to possible advantages for memory when it comes to the use of nicotine, which is interesting. We're going to talk this morning with our guest, so let's introduce him. He's joining us live on Zoom, Dr. Paul Newhouse. Good morning to you, doctor. Thanks for joining us.
Glad to be here.
It is a pleasure, and this to me is a fascinating thing. As we all age, we start thinking about memory loss, and along those lines, talk a little bit about the Vanderbilt Center for Cognitive Medicine and what you guys focus on there.
Sure. So we established the Center for Cognitive Medicine back in 2011. It was focused on developing new treatments for memory loss, studying the effects of cognitive aging and aging and memory loss, and establishing what we could do to identify it, and then treat it and maybe even prevent it as well. So we work very closely with the Vanderbilt Alzheimer's Disease Research Center, and we have a lot of cross-fertilization between the two centers. And we're devoted really to identifying the precursor conditions to Alzheimer's disease and seeing if we can prevent that and also develop treatments to prevent and treat the disease.
Okay, so before we get into some of those more details, can you give me a sense of how you know, whether or not what is normal memory loss or forgetfulness that I think in today's very busy, complex lifestyle so many of us lead, I would assume that sometimes comes with the territory. Maybe also as all of us age a bit, you become a little more forgetful. How do you know whether or not what you're dealing with is just normal and it's not a big deal and you can continue to function, and whether or not you're having an issue?
So when we age, we have normal biological changes, right? My hair turns white. We don't consider that abnormal. My joints may get a little bit creaky. We consider that normal. But when it starts to interfere with your life, that's when we consider it abnormal. And that's the same idea we take with memory, which is that if you're occasionally forgetful or you can't remember where you park your car, we don't worry too much about that. But if other people start to notice this, or it starts to interfere with your life, then we become concerned.
Okay, interesting. And I think then, would you say in some cases, you may, when it gets to the point where it's a problem, not yourself realize that you have the issue, but it will be loved ones or friends that realize, wait a second, I just told him that and he asked me it again. And if they notice that, in a pattern, they'll notice, but you may not even be aware of it.
Well, we increasingly do find people have subtle awareness that maybe their memory is not as good as before. But you're absolutely right that if the loved one begins to notice this, we become concerned. I usually ask in my clinic, if I ask a family member, I say, is your mom's memory as good as it was 2 years ago? And if the person says no, then I get a little bit concerned.
Okay. Yeah, it's interesting. I monitor mine all the time, and friends of mine, and watch it as we all get older. Is there a genetic component to that? If you have a history, perhaps, of Alzheimer's in your family, maybe you had an uncle or a father or a grandfather that had it, does that predispose you to being a more likely candidate to get it?
So we do believe that genetics is important, and we have a very robust group at Vanderbilt that studies the effects of genetics on the risk for Alzheimer's disease and also the resilience against Alzheimer's disease. We do think family history is important. So if you have a family history of Alzheimer's disease or memory loss, then that would put you at somewhat increased risk. And so we know that there are certain genes that seem to have a tight linkage to memory loss. And so we do begin to assess those genetic links now in our clinical work.
And is there now any type of test that definitively can say genetically, if you guys do it, and I've seen stories along these lines, that yes, Nick, we've just tested you because you requested it, and it shows that you will get Alzheimer's at some point later in life. Is there a test like that, or is there nothing that's definitive?
There is a gene out there which we know conveys significant risk for Alzheimer's disease, but it's not a disease gene in the sense of like muscular dystrophy or cystic fibrosis, where if you have the gene, you have the disease. It's not quite like that. This is more of a risk gene where if you have this particular flavor of the gene, we know that your risk is, for example, 50% higher or 25% higher. So we can do that genetic test now, and we actually do that in our clinical research work to see if patients are appropriate for some of our tests and studies.
And I guess that was my next question. If maybe you have that test before that cognitive decline has begun, but you're told, okay, Nick, you've got that gene, which makes you more predisposed, what can I do about it?
Right. So, for example, one of our studies that we're doing right now, we're working with a sponsor that has developed a treatment which seems to work best in those who have the high-risk gene. And so what we do is we actually screen people when they come in with mild memory loss, let's say, and if they have the risk gene, then we can actually put them on this new treatment, which we think may work better in those high-risk individuals.
Interesting. Okay, and I do want to get into the treatments here in a moment. We have a whole show, and we're going to take calls also. As far as diagnosing something, I mean, there's Alzheimer's, which we hear all the time, but there's other types of cognitive issues that come into play. My parents both are slowing down. My mom has actually been diagnosed after taking some type of test as actually having Alzheimer's. But hers is interesting. If you sit down and talk with her, you and I and her right now would be having a conversation, and she'd be lucid and she'd deliver it, and we'd go through it. Now, if I hit her with something that's a little bit complicated, or we have to do something, or something that rattles her, she's lost. Or, hey, can you use this cell phone? Or can't do it. Now, meanwhile, I have a brother-in-law who also has Alzheimer's. Now, with him, it's obvious. You and I will be sitting here, and 10 seconds later, he'll ask the same question that we just talked about. Now, my mom doesn't do that. She's not the repeating question person, okay? She'll just kind of maybe forget later, or she'll get rattled. Is there a difference between those two types of memory loss?
So memory loss is very variable from patient to patient, and some individuals may have Alzheimer's disease that strikes one part of the brain more than another. As the disease progresses, people tend to get more and more similar as the disease tends to go forward. But at the beginning, we most commonly see difficulties with memory for what we call events in time. In other words, having difficulty remembering what happened recently. And so that's the most common type of memory problem. But we do see patients who have a more variable presentation, or may have specific deficits that other patients don't. So it could be like your mom, that she has more difficulty with more complex tasks, whether other people may show just plain forgetfulness.
Yeah, okay. And, for others, well, one thing that drives my wife crazy is, I'll ask something that maybe I was just told, and the issue is there, not that I've forgotten, it's that I have an attention issue, and I don't pay attention.
That's right. That's right.
And the
we think attention is kind of the front end of memory.
Yeah.
If you're not attending to what I'm saying, you're not likely to remember it.
Exactly. I'm not hearing it. So that's not a forgetful issue. It's just that I'm kind of someone who bounces around all the time and is thinking of other things as opposed to listening to what's at hand. And listen, we'll take a break on this. This is fascinating. We can take some phone calls, 737-7587, if questions from our viewers maybe about memory loss that they're dealing with, some of the issues that are out there with regard to treatments, which is what we're going to get into next with the doctor. Dr. Newhouse will be back right after these commercial breaks. Stay with us.